You know, the situation that we're faced with now with the COVID pandemic is that it surpassed the Spanish flu in terms of its impact on our culture. Number of deaths and the number of people that are been hospitalized. It's overwhelmed our hospital and our medical care system. As trustees of this organization, our job is to try and provide for the best safety that we can for people who inhabit this campus. The statute that was relied upon for the motion to remove masks, 33-2145, indicates that the Board of Trustees of each community college must adopt a policy, and listen to the words, a policy for measures and procedures to prevent the spread of contagious or infectious disease. What our obligation and our duty is to adopt a policy and procedures to prevent the spread of contagious and infectious disease. No masks is not a procedure to prevent the spread of infectious disease. The letter from Kootenai Health pleading with us to adopt a policy in order to minimize the number of people who are going to be hospitalized as a result of this pandemic. You know, this is not about us as individuals. It's about our responsibility to others. And that's our responsibility as trustees to others who occupy this campus. I look at the procedure that we adopted, and we added a sentence that said, actions taken by the administration in this regard, that is, trying to minimize communicable diseases, are therefore reviewable by the Board of Trustees. That is not a policy to prevent the spread of infectious disease. There is no guidance there for the trustees, to set a policy, no guidance on how to handle the responsibility of making this decision of reviewing what the administration has done. No measures to prevent the spread of infectious disease. We haven't given any measures to prevent the spread of infectious disease. I came across an email that I got this week from the Idaho Supreme Court. And the Idaho Supreme Court has authorized the administrative district judges of each county with regard to risk reduction protocols for COVID. And it reads, if as reflected in the weekly publication of COVID-19 incident rates, a county's 7-day moving average incident rate of confirmed presumed cases of COVID-19 is 25 or greater per 100,000 population, the administrative district judge shall enter an administrative order defining the safety protocols that will be required in the county's courthouse. The order will, at a minimum, require all persons entering the courthouse to do court business, to wear a mask that covers the nose and mouth, and maintain 6 feet of social distance from anyone that does not live in their household. That is a policy. That is a policy with definitions to it that establishes what can be done, what shall be done, and when it shall be done. Coincidentally, they also gave the incident rates, and the 7-day moving average incident rate of confirmed or presumed cases of COVID-19 in Kootenai County for Thursday, September 16th, last week, is 58.6, more than twice the minimum allowed. We don't have a policy to address any of these protocols. In order for us as trustees, I think, to fulfill our responsibility, we have to do more than just say no. We have to come up with a viable, workable measures and procedures to prevent the spread of contagious and infectious disease. We haven't even begun as trustees to come up with a procedure to prevent the spread of contagious or infectious disease. I think that what we need to do immediately is to adopt a policy very similar, if not the same as what the Supreme Court has adopted, as a minimal movement forward to authorize our administration to move effectively to try and stem the spread of COVID. Thank you.
Okay.
Trustee Banducci
Trustee Barnes.
would like to address some of these things. These statistics are often horrifying to hear. But statistics are statistics, and we hear statistics all the time. This has been an international debate, as we all know. We see it on TV every night. We see it in social media. We talk about it with our neighbors and other gatherings. The issue isn't, for me, these statistics. The issue is that I am an elected representative for this county in my zone for a taxpayer-funded organization. And I think we can and should come up with some solutions to help people deal with it. But it's clear, because of the pandemic across the world, that this infectious disease cannot be stopped. The issue here is personal responsibility and individual freedom. I will not be a part. Please. I will not lend my vote to an entity where an individual or even an elected board mandates that a medical device be applied to individuals against their will. And I think we do need to have solutions to help them find ways to deliver these learning things. And that's why I was very interested in what we can do to help with that. We've come a long way. My whole job now is completely remote. I used to have to be on site with my clients, reviewing everything. We have come up with some creative solutions that address, because I'm not going to fly. So we've come up with some creative solutions where I can do my on-site auditing totally virtually remote. It's not ideal, but the human race has survived pandemics for millennia, right? So we need to work through this. We do need to find solutions. I do agree the board needs to help find things, but I am appalled by this wording that says we have to come up with a policy that will prevent the pandemic from spreading. I think that's just an impossible request.